The harvest season in Burundi offers some respite for 30-year-old Jacqueline and her 4 hungry children. For now, they may have just enough to fill their stomachs, but this won't last long. At a mass nutrition screening site such as this, Jacqueline's children were found to be underweight and small for their age. She was then referred to a community-based 12-day health education and nutrition course. Here she learns about good nutrition and hygiene practices and family planning from an elected community volunteer.
The main objective is just to gain weight, but also to change behavior slowly by getting the information in 12 days.
This is a community-based program supported by the government, UNICEF and partners, which is part of efforts to deal with a nationwide silent emergency. Nearly 2/3 of Burundi's children are chronically malnourished. The country also has the highest level of hunger of all 79 countries reported in the 2012 Global Hunger Index. After years of conflict, the country has made strides in reducing acute malnutrition. But chronic malnutrition is a more complex condition to treat.
Acute malnutrition is when there is really a shortage of food, and you can see that the child is, skinny, and it's very obvious. But the chronic malnutrition is a long-term problem, so you cannot see the problem.
And the social and economic cost of the country's development is enormous.
At the national level, the data shows that treating malnutrition is costing $102 million each year. So you understand that we should have managed malnutrition before it reached this level. This amount could have been invested into other sectors that could be productive towards economic growth for sustainable development of our country.
Burundi faces massive socio-economic challenges, including a rapidly growing population, most of whom live in rural areas and below the poverty line. There is limited land available, which means families often cannot produce enough food, and also don't have information on how to combine available foods to ensure children get a well-balanced, nutritious diet. This is why malnutrition has now become a political priority, and the government recently joined the Scale Up Nutrition Initiative, a global force made up of private sector players, different ministries, and UN agencies, all with the aim of addressing the world's nutritional needs. And if the country is to achieve its goal of reducing chronic malnutrition from 58% to 48% by 2016, it will need to tackle this from all sides.
The society is really realizing up to the highest level that nutrition is a key challenge. Then we have to act now, but we have to act concerted. It makes no sense to work in parallel. We won't have an impact.
As Burundi tries to weave together all the elements needed on a large scale to deal with chronic malnutrition, already, albeit small, the tide is beginning to turn.
There has been a change regarding nutrition. Why? Because those who came for the course can show others what they learned and ask them to follow their example.
For Jacqueline, an end to day 2 of the course spells hope, mostly because she's now empowered with information and that she has some support in what is clearly a battle to keep her children alive and healthy.